Hi, Mr. Lopez. I'm Edgar. I'll be your student physical therapist assistant today. I know you have a distal humeral fracture today, and we're gonna do some massage. We're gonna try to get that swelling down. We're gonna work on that muscle spasm. So, can you tell me out of 10 today, what's your pain at?
8 out of 10.
Okay. So, before we get started, I want to make sure it's fine. I'm just gonna be grabbing the lotion, and we're gonna be working up and down your arm. Is that fine if I touch you right there?
Yes, sir.
Okay. Now, before we get started, I also want to make sure you don't have any cancer within this area. No?
Nope.
Okay, looking at your skin, it looks fine. There's no wounds. It's a normal color. So, we're going to start with the massage, okay? So, what I'm going to do first is we're going to do something called stroking. And what that is just going to get the patient used to my hands and then warm up the lotion. And we're going to work our way up the whole entire arm. We're just giving some light pressure. Just so the patient can get comfortable and used to my hands. And then we're going to do this for about a minute or so. And then after that, we're going to move on. I'm going to do something called effleurage. So what I'm going to do is he gets a little bit of swelling in his hands and his fingers. So what we're going to do is we're going to try to push the swelling up to his arms, into the lymph ducts. That way the body can excrete it later on. So we're going to start from our hands all the way up to the arm, up to the bicep. Since it's just a small body part, we don't need both our hands. We can just use one at a time. And we're adding some good pressure to push the fluid up into the ducts. And grab some more lotion. And then we'll do this for another 2 minutes or so. And by pushing some of this fluid out, we're also going to be breaking up the pain spasm cycle. That way he doesn't feel as much pain, and hopefully that pain won't restrict him, and we can also increase his range of motion. And then after we're done with that, we'll do some massage. You can zoom in on my hands right here. What we're going to do is just a little bit of circular motions right around here on the bicep, so we can try to break up the muscle spasm and relax his muscle here. And then we'll do this for another 2 minutes or so. Now after we're done with the massage, we'd follow up with a stretch. So I would take his arm out. We'll get a nice bicep stretch because at the beginning we took our assessments and he's still lacking a little bit of extension. He's only at 30. So we want to try to get to 0. So we would do this for about 3 sets, 30 seconds each time. And we will hold it until he feels a nice stretch on the bicep. You feel it in here?
Mm-hmm.
Okay. Okay, and then we'll do that 2 more times. Then after that, we will reassess them because at the beginning we reassessed his range of motion and his strength and his pain. So now we would ask him, how's your pain feeling now?
Better.
Better. What would you rate it at?
2.
2? That's good. With the massage, his pain decreased. And then we would assess his range of motion and see if it went down at all. All right? That's it. We'll start with your exercises now, all right?
Okay.
Video.